Welcome back. Well, steady state for the markets. So let's shift focus away from the equity markets for just a bit. We are now in the second phase of vaccinations. The priority group comprises of those over 60 years and those over 45 years, but with specified co-morbidities. Mumbai yesterday, in fact, added 29 hospitals where vaccinations can now be carried out. The list includes Wockhardt, which has 2 hospitals in the city. It will be the 4th private hospital to start vaccinations in the city of Mumbai. To understand the challenges and the opportunity, we have with us Zahabiya Khorakiwala, the MD of Wockhardt Hospitals. Zahabiya, thank you very much for joining in on the show. If you could just start by telling us which of your hospitals are empaneled to give vaccinations, and have you started vaccinations? What is the process? Are you facing any sort of challenges at this point?
Hi, good afternoon, Ekta. Thank you for having me. Currently, it is our South Bombay Hospital at Mumbai Central that is vaccinating patients. Our Mira Road Hospital would soon, I think, also be allowed to vaccinate. It's the first day. The process is fairly straightforward. Essentially, everyone has to pre-register on the CoWIN app, and then it leads you to uploading your identification. With that same identification, the patient needs to come into the hospital. We verify that, and the vaccination process, of course, the vaccination itself takes barely a minute, but about 30 minutes after that. Prior to this, we were inspected to be a vaccination center and whether the appropriate storage conditions are in place, the people, etc. We had already started vaccinating our staff about a week ago with the permission the government had given. So the dry run, so to speak, of the process and the flow has already been in place for a week or so.
Okay, just a two-part question, Zahabiya. There was a lot of confusion apparently in some quarters yesterday with regards to some technical difficulties on the app and things like overcrowding as well. How are you managing those two challenges in particular, and how many vaccinations do you think can take place each day?
So currently we have been given about 1,000 doses of the Covishield. We believe that we could ramp up our ability to vaccinate quickly from initially maybe a couple hundred to say 500 plus. Obviously it will depend on the supply we get. In terms of the app challenges, I think because all the hospitals had not been yet activated on the CoWIN site, people were unable to actually take an appointment. The registration, however, people have managed to register themselves, which is a precursor to even coming in as a walk-in for the vaccination. So I think the registration is okay. The appointments were really an issue, I think, yesterday, which should be sorted out, I think, in a day or two.
Well, Zahabiya, good to speak to you, and more power to you as well as your team, COVID warriors, as they call it. Together, we're going to fight this deadly disease. So, all hopes on that. But getting to a couple of financials, then, 250 rupees, that's the cost of the vaccination is what we understand. How much does it cover in terms of cost for you? Or will there be a bit of a loss that you'll be incurring?
So out of the 250 rupees, the 150 is the cost of the vaccine. So that goes directly to the National Health account, the government account. The 100 rupees is really for, for the hospitals to provide the service of vaccination. I think it's, it's what we have to do. It's required for really, private healthcare really forms a very integral part of India's infrastructure. So it's imperative that we participate in the vaccination program to get the, population vaccinated as quickly as possible.
What would be an ideal cost? You would have put forth a rate. Was it higher than this 250 rupees? I understood from a couple of hospitals that was at around 400 rupees. Would that be more ideal?
I mean, obviously, because there is a logistic cost involved in the entire process. Today when you go to get a vaccination at a doctor, that is roughly what gets charged. So yeah, I mean, but I think the government has, has taken the mandate of really vaccinating at a low price nationally, and so that's what we're going to be doing.
Okay, how much of your infrastructure, Zahabiya, are you using for vaccinations? What I'm trying to understand is that is a lot of your OPD or outpatient department infrastructure being used to vaccinate people, and hence you're probably seeing lesser inflow there?
So actually, yeah, we have had to, kind of operationally align things a little bit. We have used one of our OPD floors for the vaccination. The cafeteria that we usually have is kind of going to be used for the holding area, the post-vaccination, the 30 minutes people have to wait. So that will definitely be used, and some of the outpatient areas as well, and some dedicated elevators for the vertical movement.
Okay, Zahabiya, Mumbai in particular has seen, obviously, and Maharashtra has seen a surge in cases recently, COVID-19 cases. Have occupancies in the hospital increased in terms of COVID-19 beds? And how does it compare to your non-COVID-19 occupancy right now?
Yeah, so I think there has been a slight surge. We've seen about 1,000 odd cases in Mumbai of the last few days. At the hospital as well, we've seen increase in our COVID numbers, definitely. From what we were seeing about 10 days ago, we've seen a doubling of that approximately. The non-COVID is also now, people are coming in. There is, the period for which they could withhold a lot of, clinical interventions. People can't hold that out anymore. So that is also coming in. But I would say that on the non-COVID side, it's about, I think we have about, 70% of our occupancies on the non-COVID, and about 30-40% is on the COVID.
Okay, all right, Zahabiya, we're going to leave it on that note. Thanks very much for joining in and speaking to us. So that is Wockhardt Hospitals talking about the vaccination drive as well as the COVID-19 and non-COVID-19 occupancies at this point in time. Not listed, but very important in terms of the current scenario which is taking place with regards to COVID-19. We'll take a break now, but